I recently had a conversation with Klaus von Zastrow, a PhD and Executive Director of Learning First Alliance, a nonprofit partnership of 18 major national educational associations that collectively represent over 10 million educators, parents, and policymakers. He said, quotes, "I was wondering if you had ever taken on the issue of physical education in schools, which more and more advocates are characterizing as a public health issue, as more of the typical child's school's day is given over to math and reading instruction. Time for physical activity, recess, or physical education has all but evaporated in many schools. A number of my members are quite concerned about the public health implications of childhood obesity coupled with the erosion of physical health education." Close quotes. I shared with Dr. Van Zastrow some of the programs I've done on childhood activity and obesity over the past 5 years. They include Overweight Kids in America, Exercise and Childhood Obesity, The Real Story Behind Obesity, and The Cost of Obesity in America. In each of these, at some point, the connection between childhood health, weight, and exercise was made, and the distressing admission, little has changed in the last 5 years at the interface of childhood obesity and exercise. In fact, things appear to be getting worse. That childhood obesity is on the rise is undeniable. The rates have been advancing steadily over the past 35 years, with obesity growing from 5% then to 16% of young people aged 6 to 19 now overweight today. An additional 31% more are viewed as at risk of becoming overweight. A sedentary lifestyle is a known major contributor to obesity and poor health. Almost half of all young people between the ages of 12 and 21 get no vigorous exercise at all on a daily basis. Sedentary children are more likely to become obese, and obese children have higher blood pressure, higher cholesterol levels, and a greater incidence of type 2 diabetes. Obese children are very likely to become obese adults, troubled for life by a wide variety of chronic diseases. Young women and minorities are at special risk. The probability of becoming an obese adult, if obese at the age of 6, is 50%. The chances rise to 70 or 80% if the child is still obese at age 13. In young women, inactivity and obesity go hand in hand. 25% of American women don't exercise at all, and 60% don't exercise at recommended moderate levels during the day. Now, if women are at special risk for inactivity and obesity, so are African Americans and Hispanic Americans. 4 of 10 African Americans and Mexican American youths aged 6 to 19 are overweight or at risk of becoming overweight. We know that physical activity can really help. The CDC says, quotes, "Inactivity among adolescents is a contributing factor to the increasing trends in overweight. Regular physical activity has additional health benefits, including improvements in aerobic endurance and muscular strength, reduction of risk factors for cardiovascular and other chronic diseases, increases in bone mass density, higher levels of self-esteem and self-concept, and lower levels of anxiety and stress." In 2003, 1/3 of high school students did not engage in the minimum recommended level of moderate or vigorous physical activity. Schools have been recognized as a key setting for increasing participation in physical activity among students. The findings in this report indicate that the prevalence of being enrolled in PE class and being physically active during PE class has not increased since 1991, close quotes. That's what the CDC had to say. The CDC has developed guidelines for school and community programs to promote lifelong physical activity among young people. Although the guidelines recommend daily PE for all students, only 8% of elementary school students and 6% of middle school and high school students provide daily physical education. Some point to the 2001 No Child Left Behind legislation as a contributor to the problem. Since the outcome-based approach, placing schools at risk for poor performance, was enacted, 9% of school districts reported decreasing time on PE by an average of 40 minutes a week to make more time available for English, language, arts, and mathematics. Schools serving economically disadvantaged students fared even worse. In disadvantaged schools, 14% of the districts with at least one school identified for improvement, corrective action, or restructuring under the No Child Left Behind Act reported cutting PE by an average of 57 minutes per week to make more time for reading, language, arts, and math. But cutting PE may actually have an unintended consequence for the designers of No Child Left Behind and the school districts doing their best to comply. And it's this: studies have shown that organized school-based physical activity can have additional academic benefits. 5 days a week of regular physical activity has been shown to have a positive effect on children's cognitive function. Children who score well on 2 measures of physical fitness, aerobic fitness, and body mass index, tend to score higher on state exams in reading and mathematics, a relationship that holds true regardless of gender and socioeconomic differences. And that brings me to the Fitness Integrated with Teaching Kids Act, or Fit Kids Act. It's currently under consideration by Congress. It would require state accountability systems under Part A of Title I of the Elementary and Secondary Education Act of 1965 to measure not only student academic progress, but their progress toward a national goal of 150 minutes of physical activity weekly in elementary school and 225 minutes of weekly physical education in middle and high schools. It also directs the Secretary of Education to contract with the National Academy of Sciences to formally study approaches to improve student health and participation in physical activities, to assess the cognitive impact of physical education, and to evaluate the overall value of physical activity for student health, enjoyment, challenge, self-expression, and social interaction. The Fit Kids Act sounds like a great fit for advancing this nation's preventive health. For Health Commentary, I'm Mike McGee.